Certainly it's a very frequent disease, and there are different types of let's say damages or causes of such a damage of the inner ear, being, for example, medication. Particular types of medication can cause a damage to the inner ear, or sound or noise trauma. And typically it means that, for example, if you have a hearing impairment, it does not mean that you necessarily have tinnitus, but the probability with which tinnitus emerges is significantly increased. Well, there are two types of tinnitus: the subjective, so-called subjective tinnitus, and the objective tinnitus. Objective tinnitus means that there is a sound source, for example, a malformation of a vessel that really causes or generates sound, and this sound can be detected by the patients, of course, but also by a physician. But the larger group, and that's what our therapy is working on, is the so-called subjective tinnitus, meaning the patient hears a sound, a ringing, a tone, or whatever, without an external sound source. And this is a so-called phantom phenomenon. You hear something, although it's not present, so to speak. And the reason why this occurs is currently believed to be the following. It typically starts with the damage to the inner ear, or to the peripheral hearing system. For example, an impairment of the inner ear of different kinds, sound trauma or something like that. First you have to go to the ENT and check what kind of tinnitus it is. Because patients, for example, with a malformation or with a tumor, they have to be operated on. Stress or distress, negative types of stress, certainly increase the probability with which tinnitus emerges. That's clear. And it's and of course also, let's say, psychological problems or psychological difficulties, or even psychiatric diseases may also increase the probability with which tinnitus increases, provided you have, for example, an inner ear damage. By means of different stimulation modalities, by means of electrical stimulation, by, for example, directly stimulating the membrane of a neuron, or by means of non-invasively, by means of sensory stimulation. So it goes via the physiological pathways to the brain and enters the neurons that are synchronously active via the synapses. Both approaches are possible. And of course the non-invasive approach is more, in some sense, more beneficial for the patients, because you do not need to implant an electrode in the brain. And therefore, this is of course my wish, to develop as many non-invasive techniques as possible. And what we've done is we've developed an acoustic stimulation technique which selectively counteracts the pathological synchronization by desynchronization. It's an acoustic stimulation which has the following goal: due to this long-lasting desynchronization, the network is no longer able, or really unlearns the connections, the connectivity, and therefore unlearns the pathological activity underlying and generating the tinnitus. We counteract this synchronized activity by means of mild and weak sounds, specifically tailored to the tinnitus of each individual patient. We perform during 4 to 6 hours a day, during a couple of months, and by decreasing the synchronization, the synchrony within this affected neuronal population, finally the neurons unlearn their strong connectivity. This is the goal of the therapy, so that they are no longer able to resynchronize.